Implant surgery precision can be improved by integrating a digital workflow, combining an intraoral scan and a CBCT to plan surgery that is safe and successful for your patients. From here, you can also design and print or mill surgical guides to further improve clinical outcomes. I'm going to show you how with the Helios 600 intraoral scanner, you can use Exocad to improve your implant dentistry. Here we have some scans completed using the Helios 600. To plan an implant surgery digitally and fabricate a surgical guide, we use CAD software to combine CBCT data and intraoral scan data. First, you need to import all the data into your software of choice. You can use literally any surgical guide software, and there are plenty of options on the market like Blue Sky Plan, 3Shape Implant Studio, or Exoplan by Exocad. In this particular video, I'm going to show you the Exoplan workflow. When using Exocad, we will import our CBCT data in DICOM format and follow their workflow. This involves defining the panoramic curve, as you can see here. Next, we choose the CT alignment workflow. In this case, we'll be aligning the CT X-ray data to an intraoral scan, so we select CT to mesh alignment. So next we import and load the jaw scans into the software and align this with our CBCT. We do this by choosing reference points that apply to both our CBCT data and our intraoral scans, and these are typically the teeth. You need to evaluate the alignment and then make sure everything looks perfect. This is critical as your entire plan will be based on this alignment. Next, you will define the mandibular canal or sinus segmentation, depending on which arch you are working on. This is to create collision objects and warns you if your implants are getting too close to key surgical anatomy sites. Once this is done, we are ready to start designing our surgical guide. As with all guided implant surgery, we follow a restoratively driven process. What this means is we place a model tooth in the edentulous area and then reverse engineer the implant position to best match the final restoration. This ensures that the implant is in the ideal position for the final restoration. Here you can see the model tooth being placed from a library of teeth. Once this is done, we then start with our implant positioning. You can place your implant anywhere in 3 dimensions using the CBCT and scan data to help guide your digital implant placement. The key is to respect all the anatomical features and to ensure that the implant position will facilitate a successful restoration. From here, we carry out sleeve placement of the implant sleeve. This can vary based on your implant of choice, but a metal sleeve is typically placed into your printed or milled guide. This is purchased separately, and a digital sleeve file is shown here. Next, you generate the implant planning result files, and now you're ready to move on to the next step, designing the surgical guide. In Exocad, when designing the surgical guide, you first create the sleeve mounts that will hold the metal sleeves I mentioned prior. Then you prepare the fitting surface of the surgical guide. This is called the surgical guide bottom. You want to ensure an accurate and snug fit without causing issues with undercuts. Once this is done, you design the top of the surgical guide. This starts by placing a margin line to marginate the edges of the guide. Using implant guide software, you can also add attachments to the guide. These can be windows to confirm accurate fitting of the guide in the mouth, supports to reinforce the guide, or text such as the patient's name that can be embedded onto the guide. The final steps is then merging the surgical guide. What this means is you will now merge all the different parts of the guide that you have designed into one single unit. You can then make any final adjustments by using the free-forming tools to add, remove, or smooth material on this final surgical guide. And that's it. Your surgical guide is now ready, and using Exocad you can quickly generate the surgical guide files, and these can then be sent to your 3D printer to be fabricated in-house. Thanks for watching.